Thank you. So again, I'll just echo what Alice mentioned, welcome and thank you for joining me today. IMD is a proud partner of Cloud MD, and member engagement at the right time and the right place to improve health outcomes while reducing care delivery costs is what we'll be discussing today. My name's Daina Morgan, and I'm involved as a user engagement manager, and I'm happy to be a part of your support team if and when you require any help. And as I mentioned, Alice Haidau is also on the call as our senior content manager. So over the next 30 minutes or so, I'll walk you through the challenges facing the healthcare professional who is aiming for better patient engagement. We'll talk about the IMD platform and how we address those challenges. This will include a live demo of our platform, and I will wrap up with some benefits enjoyed by organizations using IMD, and I'll give you the steps to get started on the IMD platform if you haven't already had an opportunity to jump on. So it's probably no surprise to you that patient engagement is in need of improvements, and here's a little bit about why. Typically, a patient walks out of a visit remembering only 20% of what their healthcare professional told them, and from that, only about 10% correctly. 54% of Canadians felt their medication was explained well, and about 80% of patients do not follow treatment plans because of lack of information. So this leads to considerable costs to our healthcare system, and then the unengaged patient costs the system anywhere up to 21% more. These costs come from being referred around and readmitted, testing and expenditures increase, while the adherence to prescribed medical treatments decrease. So this all leads to a slower recovery. So this is where IMD steps in. IMD came to be to create happier, healthier, better informed patients by equipping healthcare stakeholders with the resources that you need when and where you need it. Because with an e-health delivery platform, better patient understanding leads to treatment plan adherence and better health outcomes. And how does IMD do that? We do that with many organizations that have a vested interest, including the organizations that this audience represents, the Canadian Lymphedema Framework. IMD is built for you and users like you. We have a lot of great content and can build it into a platform made for your day-to-day flow. We work together with our healthcare partners and content partners to better understand the conversations that you folks are having, and also leading to any custom content curation that might make sense. You still have access to the entire IMD platform with over 6,000 topics and all of the tertiary information that could come up in a conversation with your patient and is more aligned to the needs of lymphedema practitioners that do diagnosis and education. So just quickly here, there's, as I said, over 100 content partners, including you folks, of course, as the Canadian Lymphedema Framework. We have the Ontario Lymphedema Organization, as well as Canadian Cancer Society, Obesity Canada, a lot of other content partners that I think you would find helpful and useful to your therapist discussions. So in terms of signing in, you can go to the lymphedema website and click on health professionals and then IMD Health Patient Engagement Platform and sign up that way. You can also go to app.imdhealth.com and sign up that way. Basically, you're putting in your email and you're putting in a referral code if you happen to have a referral code, and that would have come from the Canadian Lymphedema Framework sign-in. So you won't have to actually enter that referral code or that field. And when you sign up, you'll be automatically assigned to your organization. And basically just follow the prompts as you would for most program signups. There are a few fields that need to be completed to better cater your experience. So once you've gone through a couple of those steps, your sign-up process is complete. Please note that you will not have access to the complete version of the IMD platform until our verification team verifies your healthcare professional status. The design of the app allows for the sign-up process to be done in under 60 seconds. You can quickly and efficiently sign up and immediately get access to the IMD environment. You'll be given a membership to our demo preview environment, and the vision is to give access immediately, and the IMD internal validation team will validate and check with the local college, make sure that the sign-up person is a valid practicing clinician, and then at that point, we will allocate your account to the clinic specified. And what you'll find is any gated content that might be attached to that specific instance will be available only to that curated specific experience. So only available specifically to the Canadian Lymphedema Framework. If there's nothing further, I think I'd like to go into a demonstration. Any questions, comments, concerns before we jump into the demo? Okay. So I will just jump into the demonstration here. Again, Alice, if you could just let me know, is everything working properly?
Yep, all's good.
Okay,
Thank you.
fabulous. So I've signed in with my name, Daina Morgan, and I'm part of the Canadian Lymphedema Framework. You can see your sign-in credentials top right-hand corner, then you know you're in the right instance. Also, the Canadian Lymphedema Framework logo is top left-hand side. So again, that just reassures you are in the right place. A couple of different ways to get to a variety of different pieces of information. We will definitely look at educating a patient, but I just want to very quickly show you a couple of other things. We also have health associations, and this goes through our Canadian partners as well as our US partners, different patient support programs that are with different pharmaceutical and clinical companies. Something that's used quite often is health equity. Obviously, November is Movember, and men's health is a great focus right now. But as you can see, lots of different pieces, including patients new to Canada and patients of color. And don't be afraid to use this toggle bar. It brings you up and down along that left-hand side menu bar where you can quickly jump on some of these tiles or these shortcuts to get to what you're looking for. As I said, we're going to be looking at educated patient, but there's a couple of ways of getting to that educated patient. If you'd like, you can type in the search bar here, but I like jumping in via that educated patient tile. As you can see, when I hover over it, it turns dark blue. It's just a left click, and then I'm in that sign-in area. At this point, you don't have to put in any information at all. You can just hit start. So by hitting start, you're in what we'll call the landing page for patient education. As you can see, there's a couple of different areas here. The left-hand side is human anatomy, a human anatomical diagram. You can click on different areas of the anatomy, which will then give you different drop-down menus to then look at different diseases or different um, issues your patient might have. Another way is, again, to use this search bar, or as you become more familiar with IMD, you'll create your own shortcuts. And because I'm in IMD quite often, I have many shortcuts. So as you can see, I have resources shortcuts as well as topics shortcuts. But because you're new users, I imagine you won't necessarily have shortcuts set up. So I'll just type in, but you have to make sure you spell it properly, lymphedema. So here we go, lymphedema. There's a lot of different choices here. Again, I've got this toggle bar to choose whatever it is that I'm interested in. In my case, I'm looking at lymphedema. So typically what happens is on these topic landing pages, we'll end up in a Mayo Clinic text-based information session. And we end up in an overview with these 5 different pieces: introduction, symptoms, causes, risk factors, complications. If you check the bottom left-hand corner, the bottom middle corner, if you're ever wondering the source of the content, here you can see it's Mayo Foundation, it's the Mayo Clinic, and it was last updated this year, 02/11. It is American, so I'm pretty sure that's February 11th versus the second day of November, because that would have been today, right? So yeah, it's got to be February 11th. Anyway, if you were interested, that was the last time the information's updated. Because we have this fantastic partnership with the content partners, as they update their information, we then also have the latest and greatest information available on our patient education tool. So you can always rest assured that you have the most up-to-date information from whomever the subject matter expert is, from whoever that content partner is. Um, Another thing to look at, this little arrow, you can click on that arrow, and as you can see, a whole bunch of resources drop down, including the Canadian Lymphedema Framework. As you can see, we have a lot of fantastic information from the Canadian Lymphedema Framework. Also, general care and tips, skin care treatment, information about compression bandaging. We had a little discussion around that before we started. This is a one-page document that gives some information, and this was written in 2014. And all kinds of fantastic information from the Canadian Lymphedema Framework, as well as other um, um, uh, partners within lymphedema. As you're looking on the top right-hand corner, you can see there's a a count up timer. So we've been in this patient session for a little over 3 minutes, and we've got four different resources that we've looked at. And that's what that little paper clip means, four different resources, four different attachments. And when we're ready, we can pop into this pink envelope button, and that will allow us to email the information to our patient. Um, so if we were interested in anything else, perhaps condition management, we could look at approaching your doctor, tips around discussing lymphedema with a healthcare provider. And again, you can see the information, the attachments are being populated. So let's sort of consider that we've finished the pieces of information in which we're interested, and we're really interested to continue with our patient education email. We would pop or click, left click on that envelope. And as you can see, we've got a session summary. And here we have a bunch of different pieces that we looked at. Perhaps I feel that some of these pieces are inappropriate. So lower back strain, I'll get rid of that. Maybe everything else looks pretty good. We have the lymphedema overview and some of the other pieces that we looked at. If you'd like, you can type in a note, just whatever is appropriate for your patient. And you do have to type in a patient email if you want the email to be sent. So I suggest that if you want to practice, just type in your own email and see how it shows up in the inbox in email. You can also send it to a second email. If your patient has a primary caregiver or a loved one who also should be included, you could type in that second email as well. You click on the okay, everything's good box, and then you can send the email. You can also choose to not send the session. In this case, I'm going to send the email so you can see it says the content was sent to the patient. You know that it's been successful. The email that to which you're sending shows up, and you can actually close the session, and then you're ready for your next session, your next patient education piece. What I'd also like to show you folks is potentially some of the other pieces of information, the other content that could be helpful to you. Now, obviously, the sky's the limit, but from what I understand, you're often dealing with breast cancer patients. So here you can see I've shortcutted breast cancer. I've also shortcutted the Canadian Cancer Society. So if I hop into that breast cancer, and again, you could type it in the search bar. we've got that Mayo Clinic landing page with those 5 different pieces around risk factors, et cetera, et cetera. Also, different patient support programs. And there are patient support programs that get into different workbooks and different worksheets, and this one happens to be through Lapelga. Um, Other patient support programs, I'll just quickly jump in, are contained there as well. Um, but some other pieces that you're probably interested in are health and wellness and understanding and lifestyle. So there's some great information around rethink breast cancer and different patient stories. So if a patient wants to better understand what they might be going through, there are YouTube videos. There are also different PDFs and brochures that you can look at. Also, related conditions and advanced care planning, as well as supporting diagrams. So, if someone was looking at breast cancer and trying to better understand where exactly their cancer is, you can click on this drawing tool and you can then draw, circle, make a notation of exactly where the issue is, the lymph node, et cetera, et cetera. And all of this is going into that patient summary package. Once you're finished with the drawing mode, you simply turn it off. So there's a lot of different tools, a lot of different media-rich content that you can then use for your patient education. And often as well, we're looking at different related topics, which might include, a mastectomy or different things like that. Also, perhaps chronic pain. So if you wanted to, you could type in chronic pain. Oops, I have to spell it properly. Here we go, chronic pain. And we have some fantastic information, some fantastic videos that also get into very, very specific anatomical videos to better understand, where the nerves are. Also, different related topics and professional tools around something that was of great interest to some of our therapists in BC was Pain BC. So, getting information from yet another subject matter expert content provider, Pain BC, and we have this fantastic video as well as different pieces of information. Again, that the chronic pain content has. So we can again go to that summary, the completing the session. In this case, I've chosen not to send the session, so I just simply click on end session without sending, and it takes me back to the landing page to educate a patient. So we're very quickly and easily back to where we want to be in terms of starting another session. So I'm just going to jump out of that demonstration for now and go back to the PowerPoint slide presentation, just to give you an idea now of what we were just looking at. So it's really a 3-step process. It's a standardized, easy navigation. You find a topic, you view the content, and whatever content is of interest, you can share it via email, and then there's a patient at home review. And this is something like what it looks like. And I can actually pull up my email and show you what that specific email looks like that we just sent a few minutes ago. So here's just another idea around what this patient journey with IMD might look like, and just to personalize a little bit more. So let's take a look at the journey from the patient's point of view with a female breast cancer patient. It begins as a consultative experience with their attending bedside nurse. The nurse helps the patient to visualize. We might talk a lot about health and wellness, lifestyle, different attitudes. And also, the patient can be given easy to follow side effect management to assist with joint pain from the Canadian Cancer Society materials. And it also allows the patient to better know and control their journey. We navigate to the partner content, which is medically vetted and peer reviewed. Other sources can be rife with misinformation, as we all know, good old Dr. Google and such. And there's even the ability to attach a patient support program video. All of this is seamlessly available to them to be sent to their email. This is so important because you only have so much time to connect your patient with a leading patient organization and integrating lifestyle and mental health and wellness. So this is a great way to connect and better support a patient really quickly and fast. So, what can IMD do for you? We've been hearing these comments from our growing list of users, which is in the thousands now. So, reducing communication errors, creating that custom information. Also, saving you folks, the healthcare professional, time, organizing information that the patient can then self-lead, reducing waste and costs on printing. It supports very much a holistic approach to healthcare, and the patient better takes care of their healthcare journey as they're given very clear, actionable materials. They get at home, they can review as many times as they need, and they can also share with their loved ones. And it then leads to an improved patient experience. You're providing a tailored package and you extend your care beyond that transactional consultation, and the patients feel more supported. So just in summary, I hope that you've enjoyed to see how the IMD platform can assist you in your patient visits. I'd like to remind you to sign up, and thanks to the partnership with IMD and the Canadian Lymphedema Framework, you have an opportunity to sign up. Thanks, Bonnie, for being such a fantastic partner. And you can stay tuned for new topics and resources to support your consultations brought to you by IMD. But obviously, we have lots of great information from the Canadian Lymphedema Framework. And, we'd like to see you make it a habit, informing and engaging your patients with IMD, hopefully being able to save some time and some energy, and having a patient that's more engaged and more in tune with their healthcare journey. And of course, what else can we do? We are always looking for gaps, if there happen to be gaps in terms of information that might be missing, or a customized piece of information that you might have paper-based. We could digitize it for you and make it available on the Canadian Lymphedema Framework instance. So please let us know. Probably Bonnie's the best person, myself or Alice as well. And we'd like to make sure that your ideas are heard to make the platform better. So that's pretty much it for me. Thank you so much for your time and interest. And I'd like to sort of open the floor to any questions or comments. And also, I'd like to welcome you to turn on your cameras if you'd like.